Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of June 27th, 2022. I'll be providing a number of updates today, including talking about the BA.4 and 5 variants, some new information about pregnancy and COVID and reinfections, and a brief update on monkeypox. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information that will help you make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the chat by direct message or by email to admin@rootsclinic.org. So here we have daily cases in Alameda County. You can see that the bars to the far left in black are the ones that are still being updated, and they're still looking a little elevated there. So we are going to just continue to keep an eye on that. There's not a clear indicator that we have a downturn just yet, although the 14-day average is coming down, so that is hopeful. We'll just need to keep an eye on it. When we look at positivity, unfortunately, that continues to go up quite considerably. We were at 11% last week, and I reported now at 13%. Of course, we know that these are all undercounts in terms of cases, just because so much home testing is going on. And as a reminder, in California, we think there's around 8 positives to every lab confirmed test. So we are still definitely seeing elevated cases. And unfortunately, we've been seeing like this zigzagging up and down with the hospitalizations, but this is a pretty significant increase over last week when I reported, when we were at 104 people in the hospital and 12 in the ICU. We're now at 136 in the hospital and 17 in the ICU. So definitely going in the wrong direction, but we know this is a lagging indicator. So this doesn't necessarily mean that cases are still going up, but it does mean that the cases that we were seeing, some of them are serious and resulting in hospitalization, including in the ICU. So what is going on? We know that we have been seeing an increase in the BA.4 and BA.5 variants here in the United States and also across the world. Here in the United States, you can see the variant proportions with the BA.4 and 5 certainly upticking considerably and just kind of increasing all across the country. You can see the share of BA.4 and 5 in those green colors here across the country. And kind of interestingly, we've seen with past waves where they sort of start more significantly on the East Coast and then make their way over to the West Coast, but doesn't really seem to be following that pattern somehow this time. As you can see here, we're seeing these big green portions here, even more on the West Coast than on the East Coast. So what is that about? It's really kind of difficult to say. What we're seeing with the BA.4 and 5, and I reported on this in the June 7th briefing, preprint article still under peer review, but it showed a pretty significant evasion of our immune system, of our prior immunity, whether that was from vaccine or from prior infection, for the BA.4 and 5 compared with even the BA.2 or even the BA.2.12.1 when we compared those to the strains that were causing our earlier wintertime surge. So where we saw the wintertime surge, then we had this new variant, BA.2.12.1, and that was about 1.8 times more resistant to our prior immunity. And then the BA.4 and 5 was more than 4 times more resistant. So we kind of know that that's what we're seeing in the lab, but we want to know, what are we seeing in real life? And it's getting more and more difficult to really be able to predict what's going to happen in different areas by looking at other areas. We know that we've been looking to other parts of the world all throughout this pandemic to try to figure out what's coming next. The UK has been sort of a place where When they go through something, then it seems like, maybe a couple weeks later, we'll see it happening in New York, and then we'll see it on the West Coast. And those patterns aren't necessarily happening as predictably anymore, because there's just so many variables we have in mind. But I'll just go over briefly what we are seeing. In the UK is definitely in a wave that is resulting in considerable increase in hospitalizations. And so they've had an actual 37% increase in their inpatient stay for COVID-19 over the last week, and their cases have gone up 23%. So the hospitalizations have gone up pretty significantly, which is of concern, and they are definitely seeing more of this BA.4 and 5 subvariants. And in South Africa, where they saw the increase of BA.4 and 5, they're not necessarily seeing as much hospitalization. And then in Portugal, which really got hit with BA.4 and 5, they were unfortunately having very increased hospitalization and death from BA.4 and 5. So what does this mean, and what can we take from this? It's very hard to interpret. I think that when we take all of this together, what we can say is that we have a variant that appears to be getting through our prior immunity much more successfully than other variants. And I think we're all probably experiencing this to some degree, that more and more people are getting it. More people who've avoided it this whole time are getting it. More and more people who've gotten it already are actually getting reinfected with it, and some even in short time periods, like within a month. And this appears to be because it must be a different variant that is getting this person infected in such a short period of time. So this is something that we are going to just have to keep an eye on, and understand that we do have a more transmissible variant. Appears to be more transmissible because it's evading parts of our immune system. Is it going to result in more severe illness? There's definitely some concerns about that, because it has some mutations that the BA.2 didn't have, but prior variants did have, that made things more severe. But those are kind of findings in the lab, and where we've got different vaccine coverage in different parts of the world. They even use different vaccines in the UK compared to here. And they have different policies around which age groups are getting vaccinated first, and boosters and so on. So it's getting harder and harder to kind of compare these things head to head. And so we'll just have to really, I think, continue to hone in on our local context and understand what is happening for us here locally. But certainly, as I've reviewed, we've still got high cases, and unfortunately, we've got increasing hospitalizations as well. Don't quite have our variant proportions just yet, but that's something that we will kind of continue to keep an eye on as well. And then also just wanting to see how that translates into the severity. And whether there's a big difference or not. Because remember, there's no guarantee that any variant is going to be more or less severe than the one before it. Each of them sort of have mutations that give them some advantages, and each one is a little bit different. And so we just have to continue to stay on our toes and remember that masks, as well as ventilation, don't care what variant it is, they're going to still be protective. And that when we know we have a more contagious variant, then those interventions are going to be even more important. And then with the vaccine being less effective against catching some of these variants, we are still seeing protection against hospitalization and death, but it's going to be a moving target. And we know that they're looking at some variant specific vaccines, or looking at some broader coverage type of vaccines like nasal vaccines. So all of these things are things that we're keeping an eye on for the future. But right now, we're still very much in this active phase of the pandemic. We've still got evolving variants. They're still on the move. They're still causing increasing hospitalization in different parts of the world, and including right here. And so we just have to stay vigilant, essentially. And wanting to kind of bring up the reminder again that it's not like, oh, I avoided all this time, I got it now, and I'm done. No, we are seeing reinfections, and reinfections have with them their own concerns. There was a recent, another preprint, so it is in the peer review stage, but it is a very large sort of analysis of the database of the U.S. Department of Veterans Affairs, and the link is in the post. And it looked at a very huge number of people within their database, 257,000 folks who had gotten a SARS-CoV-2 infection, another almost 39,000 who had 2 or more infections, and then a control group who had not gotten infections of 5.4 million. So very large control group, and they do what they can to match these different groups. So people who got 1 infection, people who got 2 or more infections, and match those against people who didn't get any infections. And the results are quite concerning, actually. It basically showed that sort of with each infection, things just got worse and worse. So it wasn't like subsequent infections were the same, or certainly not less concerning. But the risk of what we call all-cause mortality increased significantly at 6 months. And so after 6 months after having had infection number 1 or 2 or more infections, the cause or the mortality from any cause increased significantly. So right there, that's just concerning. But then it starts to get even more concerning because there's increases in just about everything else you can think of. So from pulmonary impacts to cardiovascular impacts to blood or coagulation disorders, strokes, and kidney disorders, mental health disorders, neurological issues. Really, they were all increased after reinfection compared to 1 infection. So this is not welcomed information at all, but it just underscores the fact that we need to be just as vigilant about catching or not catching SARS-CoV-2, whether you've ever had it or not. So having had it before, unfortunately, is not providing great protection from getting it again. There was a recent study that just came out. It is in JAMA Network Open. You can see it here. And it was fairly comprehensive, looking at outcomes at 1 year of age of infants of mothers who tested positive for SARS-CoV-2 during pregnancy. And they were looking at their development, their neurological development or neurodevelopment. And so as a reminder, women who are pregnant are actually at quite a bit more risk when they catch SARS-CoV-2 compared to a non-pregnant individual the same age. So if they've matched up in all kinds of ways, race and age and so on, and found that if you're pregnant and you get SARS-CoV-2, you are likely to have a more poor outcome. And we are particularly concerned with unvaccinated pregnant individuals. And so what we really want to do is encourage vaccination. I did a pretty comprehensive review of pregnancy and COVID, and kind of going through all of the pieces of disinformation or just confusion around pregnancy and the vaccine and COVID, and that was from November 16th, 2021. And so if you're interested in a more comprehensive review around pregnancies, please take a look at that. Not a lot has changed in terms of our baseline understanding of that. Just to kind of summarize, women who catch SARS-CoV-2 while they're pregnant are at much higher risk of preterm labor, of low birth weight babies, of stillborn babies, especially when the case is more severe, and it is much more likely to be severe if you are pregnant. You are 3 times more likely to go to the ICU, 2 to 3 times more likely to be intubated and need support to breathe, essentially. You are 1.5 more times likely to die. So these are all very, very concerning. And then baby, we also know, is more likely to be admitted to the neonatal intensive care unit if born to a mom with SARS-CoV-2. And so what this particular study kind of added to our understanding was what happens in that first year of life. So mom makes it, hopefully, baby makes it, but how does baby do? So this was a cohort study that looked at over 7,700 births. 222 of those were births to a mom with SARS-CoV-2. And they sort of were able to replicate or see this finding again, that preterm delivery was more likely. It was 14.4% versus 8.7%. So that is actually a pretty significant difference, not quite double, but it's significant in terms of who's going to have preterm delivery of the baby. But what this really showed is that if the mom was positive during pregnancy, this was associated with a greater rate of a neurodevelopmental diagnosis. And they actually adjusted for everything, for race, for ethnicity. So in other words, they compared people of the same race to each other, one who had SARS-CoV-2, one who didn't. Race, ethnicity, insurance status, the gender of the baby, the age of the mom, and whether they were preterm or not. And what they found was that there was a significantly higher risk of neurodevelopmental diagnoses at 1 year of age. And that if the infection happens in the third trimester, that this was actually associated with an even larger magnitude of this effect. So bottom line kind of remains the same, which is that getting vaccinated, we have not seen any safety signal among pregnant individuals who get vaccinated for SARS-CoV-2. And even though we completely understand moms always want to wait for things until after the baby's born, this is not one of those things. This is one of those times when, in order to protect yourself and your baby and their future, in terms of their development, is that the safest way to go is really to get vaccinated right away, essentially. And so the last thing I wanted to briefly touch on was monkeypox, the monkeypox outbreak, which is continuing to increase. We're seeing more cases. And last week, the World Health Organization met to decide if this was going to be declared as a essentially as a worldwide pandemic like they did with SARS-CoV-2. Of course, remembering back, I think, and in hindsight, many feel that it was declared a public health emergency of international concern too late. And there are many who believe that that is the case here with monkeypox. But nonetheless, it was determined that we're not quite there yet, but they're going to keep on monitoring to see if we get there. Essentially, I think we need to understand that this is not the same monkeypox situation that has been endemic in parts of Africa for some time. This sort of has a new flavor to it. It is spreading much more quickly, and we can't quite put back together. So in all the detective work that's going on, even though we've sort of identified a couple of events where a lot of cases happen, we can't really construct that sort of transmission chain in the way that we would like to in order to feel we have a good grasp on it. So we have kind of a blind spot. When we have people who are positive, we can't kind of look back on that chain of transmission and be assured of all the links in the chain, so to speak. So that tells us that we're probably missing a lot of links in the chain. And so this is what gives a lot of us, I think, pause and concern, because even though we're saying we're not sure if it's a public health emergency of international concern yet, those blind spots make us worry that by the time we think we are, it will already be sort of out of our control. So I think at this point, really, time is of the essence. We really do need to move faster in order to get ahead of monkeypox. We are already seeing that it is coming up in children in different parts of the world. We are concerned because, unlike COVID, monkeypox is actually more severe in children, and it's more severe also in pregnant women, like COVID. And so this is sort of the opposite of the way that COVID took hold, where when SARS-CoV-2 first swept across the country, we were losing our elders. So it kind of hit our elders first, and we had the severe outcomes in our elders first. And so that was the population that we moved to protect. And even though we know that it does affect all populations, it held true that our elders are the most severely affected. This time with monkeypox, what we have is that it's first now spreading in typically a younger population. We know that it has been showing up much more in a population of men who have sex with men and who have perhaps traveled and who have engaged in sexual activity with maybe multiple partners. And so this is the population where it is starting. And so far, there have been very few deaths. However, what we're concerned with is that as it spreads, and so there's no rule that says it's going to stay within any population. In fact, it can spread to any sector of the population. It's just more of a matter of time and of contact. And so certainly household members, other partners who can be female, women, and also household members who may be children. So basically, there's nothing stopping this from continuing to spread. We know that it spreads mostly through close contact, but it does survive on things like sheets and towels, bedding, and so on. So we're definitely worried about not only household members, but also healthcare workers and then hospital staff and so on. So hopefully hospital workers, they haven't let their guard down too much with their PPE, although we certainly do hear stories about that. But we've all got to be wearing our personal protective equipment. And I think what's most important is just staying vigilant. If you've got a new rash going on, please insist on getting tested. Testing is still not to the capacity we need it to be. It does feel a lot like the early days of the COVID pandemic in that sense. So there may be some advocacy that is needed, but that is what's needed. If you're in doubt, if you think you have been exposed, if you've got a new rash, definitely it can come along with some sort of flu-like symptoms, not always. But we definitely are going to want you to go ahead and get that tested so that we can just kind of nip this in the bud. The good news is that if you're being careful around COVID with wearing a mask and so on, then your risk of catching it sort of, you know, in a room with someone or so on is much lower than catching COVID. It's really through that close contact, which also can include, you know, droplet and breathing it and so on, but it's typically through that closer contact that we're worried about. Over the last week or so, the San Francisco Department of Public Health identified monkeypox within the wastewater. It's unclear, kind of just like with COVID, how useful wastewater sampling is going to be for monkeypox. Right now, I think it's just telling us kind of what we already know, which is that monkeypox is here. It's in the Bay Area. And we don't know all that we'd like to know about it, but I'm sure that we will continue to learn more as time goes on. Most important thing now is for every individual to know about it and be on alert, and especially for physicians and all kind of clinical staff to really understand that this is a contagious, it is a emerging concern, and that we really do need to take it seriously and go ahead and obtain those samples to see if that is the diagnosis. And then at that point, most people, especially those with intact immune system and those who are adults, they do need to be quarantined even longer than COVID, so a few weeks, 21 days. And usually they will get better without specific treatment. However, some people can get sicker and may require being hospitalized, but mostly it is just very painful. The lesions do get very painful, and so it is more so supportive treatment and quarantine, and also identifying all of those close contacts so that they can actually get vaccinated. They're doing a big ramp up of vaccine production so that we can do this vaccination, and maybe at some point we will have routine vaccine for everyone again, or at least for healthcare workers or those who are at risk. And so more to come on that front. We're very fortunate that there was already an approved vaccine for monkeypox, and so it's just a matter of ramping up production and distribution. So for now, the same precautions still apply with this pandemic, with COVID. It is still very much circulating in our environment. And with most of the mitigations kind of going away, it makes it more difficult for the average person to avoid it. So if you are going to be out mixing with the public at all, or with people who are outside of your bubble, it's still a high quality filtration mask like a N95, so that we can filter out those particles. Ideally, you're in situations where everyone is masking, although we know that those are getting further between. However, we want to encourage all those that own businesses or venues or that are hosting gatherings to really consider having masking policies in place that really demonstrate your care for everyone who may be coming into your establishment, especially those who are the most vulnerable. And to prevent the most severe and tragic outcomes of SARS-CoV-2, vaccination and booster are still very effective at preventing the most severe outcomes of hospitalization and death. And we want everyone to make themselves a treatment plan, determine now whether you would be eligible for treatment and how you would obtain it if you tested positive. And along those lines, if you don't have a primary care provider, please get one. Make sure you know how to reach them before you need treatment. Hopefully you'll have this conversation with them one of these days. I would love it if the doctors would just prescribe it when they know a person is going to need it if they turn positive, and that way they just have it in their medicine cabinet. We're not there yet, but I can always hope. And please maintain a balanced diet, get some exercise, enjoy this beautiful weather, get some fresh air, manage your stress, consider a multivitamin supplement with vitamin D, and get a good night's sleep. Thank you so much for joining us. We'll look forward to seeing you next week, Tuesday at 10 a.m. See you then.